Good evening from my star in the galaxy. Good afternoon from Scotty's star in the galaxy. This is TMS Roundtable Recovery. My name is Dr. Tovah Goldfine, and I'm here with a wonderful guest. All my guests are wonderful, but Scotty, you're wonderful. I'm going to introduce you in a minute. I just want to speak to the listeners and say that there may be some internet issues, and I am always really grateful, and I do my prayers to the internet and I thank them. But sometimes we have to give up some control because we can't always control the internet. So I am very, very happy if we go live and stay live. If something happens, forgive me ahead of time. Um, I always knew who Scotty was because I knew Jeannie and I knew there was a Scotty and that was her friend. But I never really met you. And occasionally, I mean, you come on my show, you say hi, and you're a fan, and I'm so grateful. And I didn't know you had a TMS story. I didn't know, Scotty. I really didn't know it because I like a story. I like a coach too, but I like a healing, inspirational, educational story so we can help people be their own doctor and be their own medicine. And I know you and I feel the same way. So when I found out that you had a history of TMS, I contacted you. I said, let's go live and do a broadcast. So I'm grateful. And I heard a bit about your story. It's fascinating. And so I want you to share it with our listeners, and anyone can ask questions and contact Scotty. He's also a coach, and we'll talk about that soon. But I really want to know what happened, when, the triggers, the emotions, the players in your life, and really 15 years of pain from, it looked like from the head to the toe.
Mm-hmm.
Start sharing.
Of course. Oh, it's so good to be here, Tova, and we're finally meeting in person, virtually, of course. And I mean, yeah, I found you when I was in the thick of it, in the trenches. I can't remember the year, probably 5 years ago or so. Oh, hi, Jeannie. Jeannie's here watching.
Hello, dearest superstar.
So yeah, of course, I was in the trenches. I was struggling, and I was finding every TMS resource. So I'm so grateful to, be on the other side of things and chatting with you today. It's very
So,
surreal.
let me interrupt you. I'm sorry, but how long have you been pain-free?
Well, that's a complicated answer.
Okay, so
But
rather than that, because you said so go ahead. So start. You
yeah,
were how
yeah.
old?
So I can go to the beginning, but I just wanted to
Yeah,
kind of
yeah,
filter in,
yeah,
that I've been, kind of following you and loving everything you're doing, for at least 5 years, right?
wow,
Since COVID era, since Rose was
yeah,
co-hosting with you, and
yeah,
of course she's greatly missed too. So I never
yeah.
got a chance to meet her, but just kind of, virtually in this
Thank
sense
you.
as well. So
Yeah.
yeah, and so yeah, where it all began. I mean, wow. Okay. Well, I was born in the 80s. It was a different time, I suppose, right? Way back then. And, you know, when people ask me, when did the pain start? It's really hard to know for sure when it started. Um, Obviously, in hindsight, we know that certain things that go on in our childhood can influence how pain develops as we grow older. But I think back of this one scenario when I kind of noticed something going on with my back, on more of a conscious scale. Surely sometimes when I was a teenager, I would wake up and feel a little stiff from getting out of bed, or so I thought. And so you'd kind of think about that for 2 seconds and you'd move on with your day and it would go away, probably because I wasn't adding any fear to what was going on. But anyway, this particular scenario that I'm thinking of was, I'm a musician. I'm a piano singer songwriter as well, and
I didn't know that. Wow.
and so I was collaborating with a great friend of mine named Amy, and she and I were playing our very first show, and we were very young and nervous, and we practiced our asses off, and we finally did the show, and it just felt so great. And obviously all these nerves and all these things were going on, and of course my perfectionism came out, and we did a great performance and everything was great. And we left and went into the parking lot, and then all of a sudden, speaking with her and my mom and her mom, all of a sudden I felt like a thud, like in my hip and in my back, which is where my main symptom was. And that's when it really woke me up. And I thought, whoa, what was that? And I didn't want to pay attention to it. I kind of wanted to repress that was even going on. And I can get to the other things I was repressing as well. But, I remember in that moment thinking, I don't want this. I can't have this. I don't want to have pain when I'm older, because in my mind, I thought aging equals pain. I grew up with my grandmother who struggled with chronic pain. It'd be interesting to have a conversation with her now. She's passed, but I would be, I could say that she would fit the personality traits and characteristics of somebody who struggled with neuroplastic pain, or at least a combination of whatever was going on with her at the time. And so that was a learned pain behavior, how I viewed pain and conceptualized it was already being implanted from childhood. And I just remember thinking, oh my goodness, this jab, this felt like somebody stabbed me in the back very, very loudly. And maybe I just kind of thought that was normal. Like, oh, I'm getting older and I'm supposed to have this pain. And I just thought that was a part of life because I saw other people in pain all the time. And so I just tried to disregard it. And, there were things that went on in my childhood, like I hid my sexuality, and we can get into that. I mean, most kids, when they grow up, you're born into a world where you are assumed to be straight. And so I learned to have this, secret that I didn't feel comfortable sharing. And so that kind of led to me repressing my true identity and feeling fearful and creating this sort of having this dysfunctional relationship with fear. And of course, my parents love and accept me, and I came out in my early 20s, but that formed my personality and who I was and
Sure.
how I saw myself in the world. And so that very much impacted the levels of stress going on in my body.
Absolutely.
So that's a nutshell about teenage years and childhood.
This is building up. I mean, this is building up.
Mm-hmm.
This isn't the subconscious mind that's active, and the brain's like, I wonder if I have to protect this person. I'm getting these messages that this isn't safe, and you're living your life, and the brain's like, I keep getting these messages that I got to protect this guy with. So go ahead. So then what else happened?
Yeah, and I guess there's a lot of shame attached to that too. And when you feel shame, it's natural to not want it. So I think that's kind of how I learned to repress as well. I'd have the thought of, oh my goodness, I'm having that inappropriate thought of, what if I am gay, and what are the other gay people in the world, and how are they treated, and do I want to be that? And in the 80s and 90s, it might not have been perceived as the best thing. And you hear about like the AIDS epidemic, and you hear about people being kicked out of their homes and things like that. So I kind of feared worst case scenario. So any thoughts about my sexuality, if that came up, I would kind of think to myself, oh, I can't have that. Oh no, I'll just compartmentalize that and put that aside and try to distract myself and focus on something else. And what I was doing is I was just shelving that into my system every time that was going on. And then, of course, that formed certain personality traits, that of course, Dr. Sarno talks about. It's this sort of type T for tension personality traits of needing to be seen a certain way in order to keep myself safe. So if I didn't want to be seen as being gay because I thought that was a bad thing at the time, then I'm going to do everything I can to make others like me, to people please, to get good grades and be perfect in other ways, kind of hustling for my worth because I felt such a sense of lack
Wow.
myself.
Wow.
Yeah.
It's really bringing home truth about inner conflict, and like you weren't trying to love yourself, and all the messages were, you're not lovable.
Yeah, absolutely. And I was telling that to myself, and inferring this message from society and whatnot. But, that wasn't even directly coming from my family. That was just what I feared. And not everything we think and believe is true. And fear thoughts they're just thoughts. And with this neuroplastic pain world, like all of these thoughts of danger are just a perception. And so this perception of myself being in danger created real fight or flight physiology going on. That's where it all
So over this time when you were questioning your identity and you were coming out, were you having chronic pain?
Yeah. So not in the sense where it was 10 years later. I was having kind of similar to how it happened when I was a teenager, and having that sort of knife in the back moment when maybe a pressure had subsided, or something like that, something that I wasn't aware of, and so in my 20s I would have sort of these acute flare-ups, and I'd heard about other people's backs going out, and so I would do things like lie on the couch for 3 days and not go to work, because I just assumed that rest is what I needed to get better. And then sure enough, it would get better. So it was kind of like little spurts going on, maybe a few times a year, but for significant days on end where I'd be lying on the floor, like in a spasm, very significantly. And I just thought that that's what backs were supposed to do. I just thought that, maybe, I was working in hospitality, and maybe being on my feet for too long was causing it. And you hear people saying, you have to wear the right shoes, and you hear all these things. So I just thought, okay, well, I'll just rest and I'll be better. And then it progressed, and I was not better from resting. You can just say that for sure. Yeah.
So you did all the medical route, you did all the medical model, and then obviously they couldn't help you. And then what? When was your first indication that maybe there, again, to our listeners, the pain is real. Yeah. We're not denying the pain. We're here to get to the cause. So what point in your journey did you see that the cause was not physical, and that it could be neuroplastic or physiopsychological?
Yeah. Well, yeah. And I can maybe lead into that by saying, like, all the things that I did try, because a lot of people can relate to that, maybe where they're at on their story, and see there's a reason why those things weren't working. But yeah, you're right. It was things like all the conventional things like physiotherapy, osteopath, massage, acupuncture, and everything from changing my diet. I saw this, I drove far out of town to see a Japanese healer, and he did some sort of like Reiki / I don't even know what it was, hovering over my body, but also massaging, and it was in his home, and very bizarre stuff. And I tried everything. I tried hanging from trees, because I thought, that whole spinal decompression theory.
I'm highly recommending that as a chiropractor.
I tried that. I would just go for a walk in the park, and I'd be like, I would see a tree branch, and I would just hang, thinking that was going to loosen my body. And so there was a lot of fear, and I went to sports medicine clinics and did all of these sort of, you should stand on your feet with 30% of your weight on the front of your feet, and 70% on your heels. And I'm just thinking now, in retrospect, that sounds ludicrous. Nobody thinks about how they stand and what their posture is like in order to not have pain. We have lots of people in this world that don't have to think about posture and don't have pain. So, but and so I did get an MRI, and that was 10 years ago this year. And, I'm in Canada, and fortunately, maybe we have more of a conservative medical system that doesn't want to, just operate on things. I'm sure if I had gone to see somebody and demanded I need surgery or something, maybe I would be a candidate. But based on the MRI findings, he suggested sports medicine, typical, the same stuff that,
So there was never an injury, or never like a bullet, or a car accident. Nothing ever happened. Just growing up as a boy.
No injury. And they found things on the MRI like bulging discs, spinal stenosis, arthritis, femoral narrowing. And those at the time, because I didn't know about pain neuroscience, those all sounded very scary and very legitimate for why I was having the pain. And of course, that's
your grandmother had it, so you have it.
Yeah. So I thought, I have her genes. I've inherited her genes. Well, no, I inherited her pain beliefs. Really.
You're so smart.
Yeah.
So then what happened?
Yeah. So I believed the surgeon, and let me just say, he had horrible bedside manner, and that doesn't make anyone feel any better. And he just kind of dismissed me and said, okay, well, you can go get these injections that we do. And so I'm thinking, oh, wow, okay, they're going to inject something, and it's going to be like an immediate anesthetic. And so I go to this clinic, and I'm in line, and you're just like another number. And then they pull me into the room, and they pull my pants down and stick this huge needle in my butt. And then I leave and I'm mortified. I'm even more traumatized. And I go home and I'm at home thinking, okay, when's it going to kick in? When's it going to kick in? And my fear was just ramping up. And I actually ended up not getting any relief from that. I felt worse than I was before I even arrived. And I was spiraling. And I knew there was like some sort of anxiety pain link. I couldn't put it into words. I had a therapist at the time, a cognitive behavioral therapist, that said, that was all managing kind of symptoms and relating to the pain differently and kinder, but she knew nothing about Dr. Sarno, or maybe she'd heard of him, but that wasn't her approach. And so I kept on saying, I feel anxious as well, and there's something going on, and sometimes I'm anxious, and sometimes I have pain, and it's doing this thing, and I worked with her for 4 years, and it was a very wonderful experience, and I learned so much about it, and that's kind of how I started my sort of self-inquiry healing journey before I found out about TMS and neuroplastic pain. So I was already in this frame of mind of bettering myself, and so that was great. Mm-hmm. And so I did what the surgeon recommended and all these things, and just blamed my pain on the findings on MRI. Mm-hmm. I discovered Dr. Sarno in 2015, so 10 years ago.
How? I always like to know exactly what happened, because it's never a coincidence.
Yeah, I think I was just Googling. I think I just kind of stumbled across healing back pain. And then I found there was YouTube at the time back then. And so I found some success stories, but there was not a lot. There was not a lot out there. And it's interesting because I remember I was swimming and things were getting better, and it was seeping into my mind, but I still had doubts. And so I kind of thought, okay, well, I've got this MRI that says this, and then Dr. Sarno says this. So I thought, why don't I just try both? And then my roommate at the time, I explained this thing. I was all excited about Dr. Sarno, and there's emotional pain causes physical pain too. And she looked at me and said, oh, so it's just in your head? And I felt devastated. I thought, oh no. And that was the moment. It was a hurdle. And that shifted my belief once more. And I felt like I needed this validation of this MRI to say, no, look, there is a reason I'm in pain, and that's not fair that you said that to me. And so then slowly this biomedical approach started seeping in again. And then I tried doing other things, like I quit drinking alcohol and I went ketogenic, and I did all these things that made me feel better about myself, which reduced the pain. But I started to disregard Dr. Sarno's theories again. Wow. And things got worse because I kept treating the pain physically. And that merry-go-round kept going for another almost 2 years.
Wow.
So this is just to say, people, when
you must have really thought this was your life, chronic pain.
Yeah.
Wow.
Yeah. And it's hard to change what we believe. And that's just to say, that it makes sense that people struggle with making that shift. I remember looking on YouTube and watching some success stories of complete strangers, thinking, like, looking at their faces, like, are they lying? Like, what is in it for them? Like, what's the truth beneath it? Can this actually work? And the skepticism I had won at the time. And so it's remarkable to think that that's how that happened. And it took me a lot to really believe it. And I'm a trustworthy person, or I'm a trusting person.
What did it take? Like, did you read the book? Did you tell me, I'm always so curious on how slowly you began to trust this theory, because it's counterintuitive. Yeah. Pain means something's wrong, but not this kind of pain.
Exactly. Yeah. So, at the time I had moments of having to stop working in restaurants. For almost a year, I was, barely working at all. And I couldn't sit in a car. My parents would have to drive slowly if we went over a bump. Constantly massaging, this trigger point that was going on. That was the only thing that kind of gave me relief. It was, I couldn't travel. I was agoraphobic. I had other symptoms like anxiety, panic, heart palpitations. Scotty. I saw all sorts of specialists. It was wild. It was a wild time. So, and it was shoulder pain as well. And so interesting that I had more than one symptom, right? As we know now, we have, it's more likely that you have one root cause, which is the brain and nervous system, if you have all these multiple sort of independent issues going on. But yeah, so to answer your question of when did I finally believe? So it was 2 years later in 2017. I went on a trip to London, England, and I had a horrible time because I couldn't get out of bed. I was in all this pain, and I was doing these sports medicine things every day, and nothing was working. And there was so much fear. I mean, I had so much fear just on the plane and having a panic attack just from being sort of unsettled and feeling unsafe in my nervous system. So I get back to Toronto where I live, and I'm at a used bookstore, and I see the Mindbody prescription by Dr. Sarno. And I thought, I don't know, it was like one of these moments that just is handed to you.
Yeah.
Very spiritual in a sense, thinking, wow, okay, well, this is it. I have nothing to lose. I've literally tried everything. And so I took the book and I read it in less than a week. And that was when I had my first real shift of, oh, wow, something shifted in me. The pain completely came out of my body. Of course, it came back later, but I had these moments of hope and glimmers that really showed that I could be pain-free. And that's how it all started.
Unbelievable. So I want to continue, but I'm happy to meet Diane, who's in the studio. And I want to just bring up, I mean, she's on the Facebook. This is a virtual studio. So Diane's question, I'd like you to answer it. So do we stop listening to our doctors? I kind of do both.
So definitely seek medical advice. No one would ever say, don't seek medical advice, right? And, many people in the mind-body community would say, we want to trust our doctors for for these very serious things. That's why we see doctors. But once they've ruled out things like, cancer, tumor, fracture, infection, or autoimmune, and they're suggesting you could just go to physiotherapy or do these things, we don't have to necessarily take that advice if that advice has stopped working for us or never worked for us in the first place. What would you say about that?
So, listen, I was thinking as you were talking, and I didn't want to interrupt, but even when I grew up, I mean, I'm in my 60s and I grew up and there was these commercials. Do you have normal morning headaches? I mean, this is what's coming out to the world. Like, do you have a normal back pain? Like, take this. Like, pain is expected. So part of it is our education. And I think, Diane, it depends on the doctor. Because, so let me say it like this. If it's acute, it should go away. Acute pain is processed here, and the body takes care of it and creates some inflammation, some muscle tension, fight and flight, and then we get better. And then we're in our parasympathetic and work, rest and digest, and we're okay. Okay, this is what happens with many, many people who I'll never meet because they're not having mind-body symptoms. But if your situation is chronic, then you need to look at it differently and see a physician who can help you understand that there's more to it. Yes. And there are physicians like that. And we study it with them. And there are physicians all over that are open-minded. There are PTs that are open-minded. There are coaches, that are open-minded. I think you have to reach out, and thank God for Facebook, because people are coming and getting help by people like you and I. And yet we're also in a rat race and a rabbit hole of the medical model. And I'm not saying it's bad. We're not here to bash doctors. We're here to understand ourselves and try to find a doctor who will treat you, not your pain.
That's right.
And if not, then just understand the difference between acute pain and chronic pain. That's almost enough. And I think it's about being an educated patient. And I think many other things, which I won't mention now. But so Diane's been in PT for over a year, and she's worse when she started. So that's kind of a sign, Diane. If you're not getting better with movement and physical therapy and what normally helps muscles and tendons and ligaments and strains and sprains, and then it must mean that it's not physical. I mean, that's partly kind of, we look at it because this PT should make you better. Surely not make you worse. Feeling worse, it's there's something very irregulated in your nervous system because it's getting a force, it's getting attention, and your body's rejecting it.
Yeah.
So I'm sure it's frustrating. I'm sure
Hmm.
it's mind-boggling. I mean,
Yeah.
you obviously went through that. You were getting injections and you felt worse.
Yeah.
Injections are supposed to get rid of inflammation. You're supposed to feel better. This is what
Yeah.
injections are for.
And I think the reason why people do like the injections or all these things is they work for some people because of the placebo phenomenon. And, you
Point.
know, it's tricky because a lot of these specialists, they are looking for serious things too. So there's a reason why we would do an MRI and to rule out all those things. And now, of course, they might not know about neuroplastic pain, TMS, and so they want to give patients some sort of answer. So their solution is to say, well, we found this thing and these findings on your discs, whatnot. But we know now with the neuroscience that a lot of doctors maybe are not up to speed with the new neuroscience. Is that this correlation is not necessarily causation, and pain-free people have all of these same sort of abnormalities in quotes,
Yeah.
but they're just normal abnormalities, which is
Yeah.
what Dr. Sarno talked about. And so I have the same MRI, I have the same, I'm sure my spine is worse and I don't have any pain at all. So, we kind of have to empower ourselves, and we're still trusting our doctors because they've ruled out all of these maybe scary things, and that's great. But now we need to empower ourselves to be to advocate for ourselves and to trust
Yeah.
ourselves that there is another solution, and it's just not conventional. Not everyone's heard about it, and there's so many reasons why that is in our society, just the way it is. It takes something like 40 years for a paradigm to shift, for people to kind of finally understand, oh, there's science to this. Oh, now we can believe this, and it's happening now. I wonder how long it took for people to stop believing that the Earth is not
Yeah.
flat. Stuff like that. It takes time,
Right.
for decades for beliefs.
Or they could understand the quantum physics and the brain and the mind, and they could, like, and for some people this works. This is mental flossing. Dr. Brad Fanisteel called it mental flossing, or mental rehearsal, Joe Dispenza calls it, or the law of attraction, or I'm going to feel better. I'm going to go for a walk. I'm going to have pain. I'm going to have sensations, but I'm going to be able to take the walk with my pain because the pain isn't dangerous. So I can walk with pain. All of a sudden, I change my own paradigm. I don't have to rest until the pain's gone. I can take the pain with me because it's not dangerous. And I can dial down my pain from 5 to 4 to 3 to 2. And it could just feel uncomfortable.
Yeah.
Like Gordon says, it'll just feel, this sensation. Like, well, I have a sensation in my back. I feel things in my body. So
Yeah.
it's a relationship. And Diane, I'm asking you to think more about having a different relationship with these symptoms. It's, it's a sense of safety and calm, even though it's not comfortable.
Yeah.
You know?
Yeah. And this idea, Dr. Schubiner, he says, hurt does not always equal harm. And so again, it's just because it's there and you have findings of these things doesn't mean that's what's causing the pain. Sometimes it can be, and we're ruling that out. But Dr.
Yeah.
Schubiner would even say, only severe arthritis is going to be causing some sort of pain. And there's all sorts of physiotherapists, you would know this too, like there's testing to see if things are functioning properly, and most people, like 90% of this type of pain is not coming from the structures of the body. So there's more of a chance that this would apply to you than not.
Scotty, your knowledge is very, very good. You know a lot, and I love some of the things you're saying. And something Scrivener says is, and I put it on a Canva and used to put it up. I haven't put it up in a while, but sore but safe.
Oh, I like that.
I'm sore but safe. So I'm just going to bring up Tina's question. Hi, Tina. I've not met you here before, and I'm really happy you're on my Facebook page. It's so hard to convince someone who's had abnormal MRIs that it might be TMS. So yes, but it's the facts. See, I love that we're leaning into science. I mean, this isn't woo-woo. And I like that there's science behind that. An abnormal MRI doesn't mean you have to be in pain. And again, if their MRI shows something and you have pain, the medicine, the surgery, the PT can help you.
Yeah.
This is what medicine and PT and surgery is for.
Mhm.
This is what ice and heat and ultrasound and TENS unit are for. This is what chiropractic and acupuncture and, shiatsu are for. They help blood and oxygen move and you feel better. But if you're not feeling better, I'm not leaning into that MRI. Because
Yeah.
I think what we're understanding here, and maybe Diane can relate to this, is that you're not an MRI. You're not a file. You're an individual person having sensations. And we know from the stories of the guy with the nail in his boot,
Yep.
that he relates to pain one way, and the guy with the nail in his jaw, that he relates to pain another way. So we
Yeah.
all grow up relating to pain in a certain way. And Scotty
Yeah.
had a grandmother with back
Mm.
pain. I had a mother with multiple sclerosis, so I have my health anxiety.
Mm.
Scotty had his grandmother, his voice.
Mhm.
And so we all have our
Yes, sir.
story. And so what do we do with our story? What do we do
Yeah.
with our story, Scotty?
Yeah. It is hard to convince, our society tells us you get an MRI and that's going to solve why you have the pain. One thing I always like to ask people if they're struggling is, can you look up maybe some articles, some scientific journal articles on other people with this same MRI and they don't have pain? And sure enough, there's all sorts of studies out there. Like I said, people have bulging discs, all the things I had, and they don't have pain. And so that's what's out there. So, the science tells us now that MRIs are not a clear indication for why someone has pain anyway. We would only want to use those things to rule out the serious things. And then we
100%.
move on. And also it's, if you are injured and you got an MRI and you found you had a fracture or whatnot, all these things, well, again, according to Dr. Schubiner, all injuries heal and scars don't hurt.
Yes, yes. And after you have a herniated disc and it's acute, you will feel pain.
Mm-hmm.
1 month, maybe 6 weeks, maybe 2 months, you're going to have pain. After that, it's not coming from the disc.
Right.
And this has been proven over and over again. And again, your pain is real. We're not denying it. But all pain is processed in the brain.
Yep.
Help me here, Scotty. And then the amygdala processes pain, chronic pain, where also fear and anger and sadness are processed. And then another part of the brain processes acute pain. So it's not even in the same place.
Yeah, that's important
This
information.
is empowering. We want to empower you. I had a chiropractor who wrote a book called Pain is a Superpower. We want to empower you that your pain is not against you. It's just your body protecting you, your brain, and it's not punishing you. We want to really raise you up tonight.
Yeah. And part of it is to get out of it, we have to raise ourselves up, and we're here to raise you up. Exactly. And it's really hard to do. At the beginning, we have to lean on other people's belief in order to believe in ourselves. And you're right about the brain. It's the studies show too, when we do an fMRI of the brain, we can see the parts of the brain that light up when someone's in chronic pain. And they're associated with the parts of the brain where we have memory and learning and emotions and all of these things. So it makes perfect sense that this is the science behind why it's happening. And so, yeah, you're right. A disc will heal. And what will happen is after it's healed, if you're still having pain there, this is what we know as a learned neural pathway. It's a neural circuit. It turns on and off like a light switch. Interestingly enough, maybe your pain comes and goes. That's also an indicator of neuroplastic pain. I'm actually suspicious of, you actually asked me if I had an injury. And maybe, kind of, I fell on my butt when I was 10 years old skiing, but I didn't break or hurt anything. But it was such a blow that maybe I had hip pain that was a learned neural pathway from when I was 10, but I never had an injury in that sense where I had to have medical attention or there was a break, anything like that. But just something like that, the brain will remember that. And the brain remembers everything that we've ever lived. And so any sensation in the body can be learned by the brain and nervous system. If the body has a function for it, it can turn it on. So for whatever reason, if I had felt stressed or triggered or something was going on emotionally, that same sensation where I fell on my hip when I was 10 can come back.
Yeah. I had an accident. There's a reason why I ask about an accident, because the body, under stress, the body will, it's actually a law I learned in chiropractic school, that your body will the pain will travel back to that place, usually to the place where you had an old injury, not because something's wrong with the place. It's because of the emotional trauma and relationship with it. And a lot of us have had rear enders and car accidents. And I was in a car accident. I was stopped and a car hit me and I hurt my wrist. And, I'm a chiropractor for 40 years. So my wrists were really important. I was like, okay, like I didn't get these insured. And it was an accident. And I had them, MRI'd and they were okay. I did some physical therapy. But every time I'm stressed, I have wrist pain.
Mm-hmm.
It's my hands. It's this connection with my body. And that's where I got hurt. So I ask about that so people can understand their timeline and say, the pain went back there. Yeah. So, I'm responding to Diane, who has CRPS, which again is her nervous system. So it's just, we're back to your nervous system is dysregulated. We're back to understanding this threat safety relationship that, Diane, you probably live in a state of threat, and who wouldn't with all these different symptoms? And look, it's not an easy answer, but the solution is to bring calm and safety and let that be the new language, to the pain. Okay, pain, I'm suffering, I'm struggling, I'm uncomfortable, I don't like you, but you know what? You're here. Let's see what we can do. Not like, and the medical system is like, take it away, fix it, put a Band-Aid, stop it. And there's no, and sometimes that works, but there's deeper layers of what's driving this pain. Why is it coming back? Why there? And so over time, a brain like yours, Diane, you're really smart. You're really sensitive. Your body's really intelligent. It's protecting you. And I think I didn't learn that in chiropractic school, that the threat safety. And by understanding this, we lighten up on ourselves. We understand that there's a solution. You will recover. You will get better. We're on here every week talking about that people can recover. My last few shows were somebody with trigeminal neuralgia and with Crohn's disease. People are getting better, and I say this, they're not special people. Dalai Lama's on the mountain. They're just people like you and I who have to be educated, who have to feel a lot of hope and have to believe in themselves, that their body's not against them. Tell us now. I wanted to lead into so give us a couple things, share with the listeners. What did you do? Did you meditate? Did you journal? Did you go to India? Did you, tell us what you did regarding your treatment plan, or how, you kept teaching the body that everything was going to be okay and you recovered?
Yeah, that is a big question. And I looked under every nook and cranny to see how this could apply to me, and similar to maybe how Diane's feeling, questioning things. I thought I was uniquely different and that this might not work for me. And I think everybody goes through that experience. So, and that is very real for us. And so I just had to kind of start buying into how this could work for me. And it began with reading all the books and looking in every corner to see what other people were saying about this, finding you, tuning in and understanding, okay, all of these people did it this way. To answer your question, I definitely have a few favorite things that helped me along the way, and ways that I work now with clients to help them. And again, it's going to be different for everyone. Not everybody resonates with every tool, so to speak. And it's going to land differently for everybody in their own nervous system and where they're at and whatnot. But when there is a profound shift that clicks for you, it clicks for you for a reason. Like personally, why does this work for you? And so I would say 5 months in, it took me about 5 months into kind of absorbing the material. Obviously, I discontinued all the things that weren't working, because Dr. Sarno suggests, denial of the syndrome is part of the syndrome. So I decided to stop going to the osteopath, to stop doing all the things, treating the pain physically, because that was not working. And then about 5 months in, I discovered the beloved Nicole Sachs. And so that was in 2018. And I began her journal speak process, started journaling every day. She is such a great mentor in this community for all of us, to just encourage us, and the passion behind it and the convincingness of everything really landed in my nervous system to the point where I felt so safe that the pain signals just stopped firing.
Wow.
That's how it happens. And so the
What
journaling
did that feel like?
oh,
Like, it's hard to, it's esoteric, but like to feel that safe.
mhm.
Tell us a little bit about what that, how do you feel?
It's funny because like I never felt like consciously unsafe, but obviously my nervous system felt unsafe, right? And so when the pain went away, it was like a spiritual awakening, because I'd been in pain for 2-3 years on an everyday basis. You know, the only time I wasn't in pain was when I was numbing pain with alcohol, which was another problem, because I remember looking at my friend one day and saying, the only time I don't have pain is when I'm intoxicated. Like, this is a problem. And so it just created problem on problem. So that's another part of my story. And I'm sober now, and almost 10 years not drinking too. But so when the pain lifts, it's just like, it's like the fog is cleared. It's you can't even put it into words. It's just this huge sense of gratitude and almost disbelief that this is possible when it happens. And you can really only understand it on this felt sense, but it's possible for everyone. And once I felt it, then I truly believed, right? Because we're still going to be skeptical, maybe, if we're in pain and we haven't necessarily seen all of the results, but hearing that is where you're going and that's where you're headed and that's what's possible for you is what's going to make it possible for you, because you're going to believe it for yourself too.
Yeah.
So journaling, and then, I spent a good summer, I would say, not really worried about anything. And I thought I was done. Oh, my healing's done. This is great. Oh no, it was not done. There was more to learn about my personality traits, the pressure I was putting on myself, because all those same things that I learned in childhood about how to be good and perfectionistic and want people to see me a certain way was playing out in my adult life now. Even though I was comfortable with my sexuality, these same coping mechanisms and maladaptive ways of behaving in the world was creating pressure, and I still criticism on myself. And when you self-criticize yourself, you're sending my flight hormones throughout your system, and that was dysregulating me still. So my nervous system was just like still very easily triggered, and then it took COVID and the fear in 2020, everything that was going on, to send me into another flare. And I think that was around the time I discovered your work, and then that just catapulted me into an even bigger self-healing journey. I was not working because of COVID, and this transformed was the trajectory to me becoming a coach as well. And because I just needed a huge shift in my life, and so that actually led to more healing. Just becoming a coach became.
I just want to interrupt you for a minute and say to the listeners that it's one of Sarno's. He has about 5 or 6 points of what he believes we could do to change our neuropathway, to start to change the habits. And one of them is, to journal and meditate and get back to exercise, and to believe 100% that it's TMS, or, but the other thing he would say is to help others. And you're like, yeah, doc, right now I can't help anyone. I'm in pain. I'm like, but somehow it's neurological and chemical to reach out.
Yeah.
And so I always say to people, if they want to be on my broadcast, you don't have to be fully recovered. First of all, fully recovered equals death. I mean, recovery is a process, like we all have TMS, we all have pains and aches and pains, but it's like this. So you don't have to be fully recovered to be on my program, but to come and talk about your journey. It's truly chemical and neurological to share and open up and to bring hope to yourself by sharing with others. So that's why the community on the Facebook has purpose and value, because we're sharing, we're opening up, we're feeling inspired, but even to the point of volunteering and helping, it's interesting point to think about that. And I had this incredible story of this woman who horrible tinnitus ringing in the ear. I mean, she really, really had terrible, but she would go and help others and it would go away. And it would
Yeah.
only go away when she was helping others. It was so clear.
Wow.
Like it
Yeah.
was only when she was helping other people
Wow.
with their pain. She had no ringing in her ears, and I was like, and then it would be there. So we're back to the relationship with your pain and
Yeah.
what's going on with you and your pain, and
Right.
and this is a sensitive topic because you have to love yourself with your pain. I mean,
Yeah.
you have to love your body in
Yeah.
order for it to heal.
Yeah. And a sense of community, like this example you're talking about, that brings safety too. And we're looking for, in a biopsychosocial approach, we have social safety and feeling connected to others, and connection with others can be regulating. We can regulate our nervous system by co-regulating with another nervous system, whether that's another human being or an
So
animal.
powerful.
And I actually experienced that in my own body once. I was on vacation, but I was in a bit of a flare, maybe 5-6 years ago, and I hadn't spoken to anybody in days. And I had a lot of anxiety, and maybe because I was traveling alone. And so I go out into the ocean, and I have the typical pain stuff, but I was journaling every day, doing what I could do. And I'm thinking, okay, when's it going to go away? I'm on vacation. Usually it goes away when I'm on vacation because we know about the vacation effect.
When are
Right?
you going to go away? Pain.
Yeah,
When are you going to go?
such resistance. So then I'm in the ocean, and a stranger comes up to me and just starts talking to me. And then the strangest thing happened. I mean, after that, the pain did go away for the entire rest of the trip, just because I think in that moment, something in me, some sort of guard that was up, or my nervous system felt feeling unsafe in some way, just needed to let go. And just connecting to somebody else really helped that in the moment. And it was just, a
Wow.
5-minute conversation. And I maybe ran into this person a couple of times after that, but it was just this profound shift that I needed, just turning a neural circuit on and off. Sometimes it just takes one little thing. If we look at the stress bucket analogy, it's just that one little thing that tips us out over the edge, spilling over with symptoms. But if we just take out just enough, and it's one thing that can regulate ourselves, the symptoms will stop firing. And it's as quick
Wow.
as that. It
I
can be
love that,
really
Scotty.
fast. Yeah.
I love it. I love it. I love it. I love it. How are you with getting back to exercise? Did you stretch? Did you do yoga? What did you do with because I'm a big believer, 100% in that I fearless movement. You got to get back to
Yep.
moving. You've got to teach the
Oh, yeah.
brain that everything is okay and that you can move and this
Mhm.
sensation is safe. This is very important. So what did you do regarding exercise?
Well, the good news is that even the biomedical approach was encouraging movement. So I was always doing that anyway. And I was a really
Great.
big swimmer, and doing all of that every day. And so that always made me feel good. And so, but it did take some work because there was pain. So I did have to kind of use graded exposure and kind of work myself up to bigger moments. And then eventually I could start running again.
Wow.
And so I've even in a flare, I've had pain come back, because we're human beings, pain can come back. The longest flare I had recently was about a week, and it was a year ago. And I went live on my Instagram channel and I showed people what I was doing. And, okay, well, I know this is happening. And after a couple days, when my nervous system was settled enough, I said, okay, well, we're going to take it to the treadmill now. And I recorded myself on a treadmill showing people, this is what I'm doing. I'm walking, and now I'm addressing the fear, and I'm talking to myself. Okay, now I'm going to pick up the speed a little bit. It's going to hurt more, but it doesn't mean it's causing harm. I'm going to start
Wow.
running. I'm going to talk to myself. I feel a little anxiety rising. Okay, let's address it. And then it's this process that you kind of learn. You're learning the language of your nervous system by doing these.
Wow.
Mm.
So smart. Such great advice. And you're bringing it down to the people like you're really speaking layman language, which I like because it really is something we can take home and apply and implement.
Yeah.
Really, really, really excited to be talking to you right now.
Can I add too?
Please,
Yeah,
please.
I'll add as well. Another big part of this work. I know I mentioned the Nicole Sachs journal speak, which is very profound. There was an element that was missing, I think, in 2020 when the pain came back, and oh my goodness, all of these things again weren't working anymore. I was journaling and it was not working. It's wild. I journaled my ass off. I journaled everything I could, but I was journaling with the wrong intention. I was journaling to get rid of the pain, and I was journaling and beating myself up and being more depressed and being hard on myself. So I was using it as a way to attack myself. And of course, the pain got worse. So we have to be very careful about that. And also, I was missing a huge piece of the puzzle, which is the body. We have to use the body to heal the body. And I discovered, I don't know why I hadn't come across Alan Gordon yet on my journey, because I'd heard of him, and I just kind of thought, well, I'm going to stay in this lane, and I'm doing the Nicole Sachs thing, and that's great. But I was missing the feeling safe in the body, feeling safe with the sensations, understanding that the sensations are not dangerous, and doing somatic tracking and allowing and processing that, and doing breath work. Like with Jeannie, I met her and we became best buds now. And so I did her breath work classes, and I just involved more that had to do with the body, because, you know about the vagus nerve, and 80% of the nerve fibers, the communication highway that's going in our vagus nerve is coming somatically bottom up, and it's 20% is top down. So we want to really utilize this power of the body to regulate the nervous system. So that was the next big part for me. And learning about pain reprocessing therapy, which I later trained in as well, is so pivotal. I had a coach as well, and she was trained in pain reprocessing therapy, and she helped me to do that. And so we did all sorts of great things: visualization, somatic tracking, created exposure visualization, and that just made my nervous system feel safe on a cellular body level. Was what healed me. So really, like, leaning into the pain to heal the pain, and feel it to heal it. Those things that we talk about, these expressions that we have, there's a reason for it. And oh my goodness, feeling emotions, right? When you're journaling, are you feeling your emotions? Are we bringing safety to your emotions? And if you're not journaling, are you feeling emotions in your regular life? Or are they being repressed and turned into energy that needs to come out as symptoms?
Well, beautifully. Well said. So I was lucky to interview. I had Nicole Sachs and Michael Galinsky on a show with Rose many years ago, or maybe 4 years ago. And, a lot of people don't like journaling. A lot of people don't want to do it. A lot of people doesn't work for them. I asked her, and she said, most people, they're lying to themselves. And I said, okay, let's tear that down a bit. And then, with the ISTDP work, which Rose did, there's a very well-known book called The Lies We Tell Ourselves. And so we all know that part of ourselves. We rationalize, we sugarcoat, we white lie. We're human. We have this condition called being human, Michael Galinsky says. We're human beings.
Yeah.
But to unravel, or what I call being naked with your clothes on, kind of like, in your journaling, it's very powerful. And, David Hanscom, one of my teachers, is like, write it and rip it up. That's what he's like, write it and rip it up. Write it and burn it. Like, he's big on that. Like, move it through, separate your thoughts, bring them out of your head, separate your thoughts, let them go. It's a powerful concept. Not everybody has to do that. But journaling is neurological, psychological, physiological, and it's not easy. We're not saying it's easy and fun. It is absolute. It's meeting yourself. Can you meet yourself? Can you look at yourself in the mirror every day and say, I love you, even though you're in pain? Like, this is the way out. And we're back to the relationship with yourself. And that's what chronic pain teaches us in many ways. And I know it sounds woo-woo, but this is what everyone's saying, from Bruce Lipton to Joe Dispenza to Tony Robbins to Mel Robbins. That's what they're saying. I mean, Mel Robbins' new book is called Let Them. It's all about judge. I don't even know what it's about, but
it's
we're
great.
not saying any. Scotty and I are not saying anything new. It's all repetitive intelligence. We're just saying it in our flavor, putting it under this umbrella, saying it here and now, and saying it together. But it's nothing new. And so the universal laws of nature, are like sustained. They're like, like Buddha says, no expectation. Moses, Allah, Jesus. We're loving all these masters. So on that note, what would you like to leave the listeners? So still a few listeners on the Facebook. So I do want to say before we round up is Scotty is a coach and has an amazing Instagram presence. Very impressive. A little intimidated by Instagram lately. And Also, I know you're also on Facebook, and you have a beautiful, beautiful way that you express yourself. So Scotty is a coach, and I know he meets people for a discovery call if they need to just get to know him. He's in Canada, and he works with online. Um, you can find Scotty in Instagram and on Facebook. Also, if you have any questions, or anyone you know out there has any questions and you didn't want to do on Facebook, you can put it on the YouTube tonight or tomorrow. It'll be recorded, uploaded, and then it'll sit there in my playlist and you'll see it. And you can always ask questions to Scotty or myself, and I'm pretty much on there. I just love communicating with you guys and dropping pixie dust of hope into your living room, into your YouTube, and inspire you and educate you that you can recover, that you are not a victim of this body, that your body's just really strong and sensitive, and your relationship with your body will change drastically. And it already has. I know, Diane, it already has. And all you out there, patience is a big one.
Oh, yeah, that's right.
Patience is a big one. Patience, gratitude, compassion. So the audience knows what I believe in. I'd like to hear more about what would you like to leave our listeners with as we round up the broadcast?
You're right about this whole idea. It sounds cliche, but knowledge is power. And, we're here to inspire and educate. And Dr. Sarno would say, the education and this knowledge of knowing that what's going on for you this is why this is happening logically, scientifically, that is the panacea to healing. Believing that you will be well is going to lead to you being well. You're being your own placebo, which is talked about in this work as well.
I love it.
Dispenza talking about it, but there is nothing pathologically dangerous going on in your body. And so, but the brain and nervous system has learned that it's learned a perception of danger. And we can unlearn it. If the brain can turn it on, the brain can turn it off. And it's just so simple. It's not an easy thing to do, but this is so profound that and it can be done for anyone. So I want people to be feeling like they have some hope after hearing this. I was once there thinking, oh my goodness, I can't get out of it. Even as an expert in this work, I've had a pain flare, and I've had that profound thought of, oh my goodness, I don't know if I can get out of this one. Everybody struggles with this. It's the curse of consciousness. It's like we're wired to associate pain with physical damage, and it's really hard to kind of combat that, because that's our nature. That's our biology.
It's our lizard brain. It's your lizard brain.
Yeah, so it is hard. So. But the more we lean into hope and optimism and knowing that we can do it, that will help. And so with my clients, I like to do a lot of work on hope and optimism. And we can even do, mindfulness exercises around hope and optimism. And Dr. Hanscom, he says that hope and optimism has an anti-inflammatory effect on the body, right?
Oh my goodness. He just wrote an article about games like ping pong and tennis and squash are changing the chemicals because you're interacting with somebody. It's fascinating. He's got a huge resource on his Back in Control site. He's very much about educating and absolutely, even chiming for autoimmune symptoms, and many autoimmune conditions respond to this work. And wow, Scotty, I'm so happy that we met. I really, really am.
This has been great. And like you said, I am coaching. And if people want to reach out to me, we can do a 30-minute free discovery call. If you're confident in wanting some more support on your journey and implementing this, a lot of times we might have blind spots and things that we are not getting to on our own. And we can't necessarily see our own limitations or what we're coming up against. And I've certainly come up against many of the pitfalls, even within the mind-body space, thinking, why is this not working for me? And I struggled with that. And sometimes we just need this support and a hand to hold on our journey where we can really feel like we can get there. So, if people want to reach out, ask questions, that's great. And I'm on Instagram, Facebook, TikTok, in Canada, I guess. In the US, to be gone. YouTube, and it's just at How to Heal Chronic Pain. And How to Heal Chronic Pain is is my name because this is what we're doing. We can heal. Just because it's chronic doesn't mean it's permanent.
Yeah.
It might feel like it's permanent because you've had it for a long time. But that's just sustained fight or flight and chronic dysregulation in the nervous system. And so we can heal this type of chronic pain.
I love it.
Neuroplastic
pain.
I
love it.
Yeah.
Dr. Scotty, you're a doctor. The first thing that I say to my patients when they walk in my office is, you're the doctor. I'm just the messenger. Because there's such a wisdom in people. And I think we dumb ourselves down and we, give this power to the doctor in answer to Diane's initial question. Like, the doctor's just doing the best he can. He's just doing his job. I mean, they're doing their job. They're fixing you because that's what they're taught. And so we can't give our power to the doctor. We can, and ask a lot of questions, pick his brain or find a new one. But you are all doctors. And
the holistic approach brings it all in, right? The holistic approach is physical, mental, emotional, spiritual.
Beautiful.
And doctors back in the day, I mean, we weren't alive then, but it was more of an art, right? And it was more about working with the person as a whole.
It's so important. And we're getting back to that. We're getting back to that in honor of your grandmother. We're getting back to really treating the person, treating the human being, and not so much the symptom, and to be loving and compassionate, and to go into our backyard and pull a weed out of there and put it in our tea or smoke it. I don't care what you do. Just
I love that.
Anyway, Scotty, Dr. Scotty, I'm so happy to be rubbing shoulders with you on my Be Live studio. And so we'll meet again.
Yeah, let's do this again.
God bless you to all of you out there. And we'll see you next week. Have a wonderful rest of your day. And good night from my home to yours. All the best.
Thanks, Tovah. Bye, everyone.
Okay, 1 second.